So the way we differentiate food allergies versus food sensitivities. A food allergy creates an allergic response. You have had to seen it before. The first time you consume a food, you can't be allergic to it unless you've had it before. There are immune properties to an allergy. There's immunoglobulins, and there's testing that we can perform with IgE or immunoglobulin therapy that is done through Quest Labs or LabCorp, where we draw the body's levels of immunoglobulin in relationship to a specific food. Some people are allergic to wheat, and we call this a gluten allergy or a celiac disease. Other people have no allergy, but when they consume the wheat, they don't digest it well, and it may cause indigestion or bloating or gas or just inflammation along the GI tract. Versus a food sensitivity is a food that you consume that does not necessarily bother the GI tract, but causes inflammation either in the GI tract or anywhere in the body. So the ALCAT testing has been most notably effective in people with food sensitivities or irritable bowel syndrome. What it does through a blood test that we send out to the company, it measures the specific red blood cell type called the neutrophil's response to up to 200 different foods. The neutrophil is the first step in inflammation. It is not an immune cell, it is a red blood cell. But when exposed to sensitive products like certain foods, the neutrophil will change shape and give the ALCAT report an ability to say, hey, this food does not change the shape of your neutrophils at all, or this one moderately or mildly or severely changes it. So on the report, we get, hey, no change, and these foods are in the green, and they're labeled in the green column, or we have mild, moderate, or severe. And obviously the severe ones, we say avoid those foods. The moderate ones, avoid them to about once a month consumption, and the mild ones, maybe once a week consumption. Digestion does relate to holistic medicine. We are what we eat. We basically, our health is determined by the ability of our digestive tract. If our gut is not healthy, the rest of us will not be healthy. So I think anyone that looks holistically is going to have to look at digestion. And if we're not consuming things that are right for our body's going to let us know and have symptoms. Now, how do we know if a food is right for our body? The holistic approach could be a rotation elimination diet, it could be ALCAT testing, it could be food allergy testing, but ultimately with every health and condition it begins with the gut. The things that we look at holistically for the gut are digestive enzymes to help our body digest foods that we are not digesting well. The next step would be to add good bacteria or probiotics. These are commonly found in fermented and live foods like yogurt or kefir or sauerkraut or fermented green tea, kombucha. These are a few examples that add good bacteria into your gut. The bacteria are there to help your immune system and to help your body digest things that you cannot digest. So if you have any health problem in your body, whether it be undiagnosed inflammation or joint pain or even heart or lung or other issues, if you're not consuming the right foods or if your body can't digest the foods that you are consuming, there's going to be an issue with malnourishment. So digestive complaints start in the GI tract but affect every organ in the body. If you have a health issue and it's not in your mind related to digestion, I would caution you saying all health is related to digestion, and make sure the digestion and assimilation and detoxification, meaning bowel movements and urination, are effective, and then your body gets the proper nourishment and relief of toxins to heal and repair.